It is my pleasure to introduce Cook County Board President Toni Preckwinkle, who was elected to the office in November 2010. We are most grateful, given her busy schedule, that Toni agreed to be here again today after delivering the keynote address for our Healthy Communities Conference just 5 days ago. The theme of that event, hosted by the Fed, the Chicago Community Trust, and the Illinois Public Health Institute, and several other partners, is closely aligned with what we will discuss today: public health as an integral part of community and economic health. Across the Fed system, we are working to help align community development and public health goals in our respective districts. And we know that President Preckwinkle understands this relationship very well. She has worked to give all county residents, regardless of income, better access to health care and prevention services. As 4th Ward Alderman, Toni championed important legislation on affordable housing and restricting payday lenders, and was also instrumental in creating what is now the Quad Communities Development Corporation. Toni is a community development leader who, in her public roles, has consistently placed good public policy ahead of politics and taken some very unpopular positions in a variety of areas to demonstrate this commitment. President Preckwinkle earned the IVI IPO Best Alderman Award 8 times in her aldermanic career, as well as the 2009 Leon Desprez Award. She holds bachelor's and master's degrees from the University of Chicago. She's also a wife and mother of 2 children and has 3 grandchildren. Please help me welcome Toni Preckwinkle.
Good afternoon. I am very grateful to be here. I thank Gordon for that kind introduction. You know, I've got lots of friends in this audience. I want to call out some of them. Bob Doherty and I taught together at Aquinas Dominican High School in the 1970s. So he and I have been friends for a very long time, and I'm grateful to him for his good work as an educator, and then he went on to be involved in a variety of educational enterprises and then St. Leonard's House. So thank you, Bob. Thank you. I want to, Calvin apparently was on the panel before I got here, so you should know that Calvin was once an intern. When I was at the City of Chicago Department of Economic Development, he was one of our interns a while ago. And of course, Bernita Johnson Gabriel and I worked closely together at the Quad Communities Development Corporation. First, Bernita was a board member, and then, of course, she blessed us to become executive director of that organization. So I'm grateful to all of them, and Sarah, and of course I see lots of people around here that I've worked with in community economic development. I appreciate the contributions that all of you have made, and I'm grateful for the help and support that you've provided to me as alderman and, of course, as county board president. So I'm grateful for the chance to be here today. Much of my public life has been focused on community development. I was alderman of the 4th Ward for 19 years. And the 4th Ward, for those of you who don't know it, is a ward along the South Lakefront in the city of Chicago. Very diverse. The communities around the University of Chicago are racially and economically diverse. And to the north and west are communities that have struggled for a long time with disinvestment, abandoned buildings, vacant lots, gangs, and drugs. We founded QCDC, the Quad Community Development Corporation, to serve the development of 4 neighborhoods: North Kenwood, Oakland, Douglas, and Grand Boulevard. These communities, as I said, were struggling, but they also had a number of unique assets in their residents and their local institutions. And from the beginning, QCDC was focused on comprehensive development that included housing, economic development, education, and public safety. We wanted to work directly with community residents and involve them in the process all the way along the way because we knew how much they could bring to the table as we tried to reshape these communities. As Cook County Board President, I understand that each community, each local unit of government, each municipality is different. And one of the biggest challenges that I face is trying to understand and meet the needs of each of these 130 municipalities that fall within Cook County. 130, I'll say that again, 130. Each neighborhood, area, and community has distinct strengths, weaknesses, and opportunities. In this time of shrinking resources, and let me just tell you, one of the terrible things about the economic collapse that we've experienced in the last decade is that at the same time that there's an increased demand for services, there's decreased resources for government. So you just have this terrible mismatch. Lots of people who need government help and declining resources as a result of the terrible economic times. In this time of shrinking resources, we found that we need partnerships and collaboration if we're going to make any progress at all. And while I visited as many municipalities as I possibly have been able to across the county, I realized that it's really our councils of government, what we call COGs, which have been established by local mayors to consider and try to address their common issues, which play a critical part in helping the county and others direct investment. Through the relationships forged by participation in the COGs, it's a term of art for those of you who don't know it, councils of government, I'll say it again, local municipalities have innovated to share limited resources and to maximize the benefit for their combined jurisdictions. Upon taking office, one of my first steps was to create a centralized Bureau of Economic Development to expand the capacity and capability of our economic developments within Cook County. Where is Herman? Did I miss him? Herman Brewer? I guess he's on his way. He's head of our Bureau of Economic Development, and I know he'll be joining you this afternoon. I want to thank him for his good work. We brought together our community development, our capital planning, our building and zoning folks in one department, and Herman has been good enough to lead us for the last couple years, and I'm grateful. One of the first economic development, here's Herman right now. See, I mentioned him, and he walks in the door. I wish I could conjure up other people as easily as... One of our first economic development initiatives was to roll back the 1% sales tax increase that was enacted under my predecessor. It gave us the highest sales taxes in the country, which was bad for our working families, bad for our businesses, particularly our businesses on the perimeter of the county. And in this year alone, we've saved our taxpayers $86 million as a result of that rollback. We know that in today's economy, we must be ready to engage in regional economic development. So we've sought out the necessary counsel and expertise to reinvent the county as a real partner in regional economic development. We created a Council of Economic Advisors. Let me just say we got together a couple dozen of the leading CEOs in the county, headed up by John Rogers, the chairman and CEO of Aerial Investments, and Bill Osborne, who's the retired chair of Northern Trust. We brought them together to help us redefine our role in terms of our internal activities, and to help us figure out how we could work better with the business community. And of course, the only real way to realize our potential as a region is to have a strategic long-term plan and to direct investments that will lead to jobs, new industries, and a renewed ability to compete with the rest of the world. And you know, when we think about the Chicagoland region, and that it goes from southeastern Wisconsin all the way up to Milwaukee to northwest Indiana. So it's not just, you know, the multi-county region here in Illinois. It's a three-state region. When we think about economic development there, we have to think about ourselves in competition, not just with New York or Los Angeles or Houston, but with Beijing and Singapore and London. We're in a world marketplace, and companies make decisions not just on the basis of the national origin of the company, but on their best interests, and they go wherever they think those interests can be best implemented. We know that as an individual worker, if you want to have a future in this economy, you have to have skills and you have to have the ability to learn new ones. So we've worked with the City of Chicago to streamline our workforce development initiatives. In Cook County, it may surprise you to learn, we had 3 different workforce initiatives. We had one for the City of Chicago, one for southern and western Cook County and one for north and northwestern Cook County. So if you were up in Palatine and you were looking for work, you would not be told about jobs in Oak Park or Calumet City or Chicago. And likewise in Chicago, you wouldn't be told about jobs in the suburbs, which of course doesn't make any sense because people live and work all over Cook County. So we put that together, put that job training initiative together, workforce development initiative together under the city-county partnership, and I'm very grateful to Karen Norrington-Reeves for her leadership. We've got a big challenge there, but at least we've got a unified entity that's working to try to meet those challenges. Transforming our workforce development initiatives, though, is not enough. We must expand and strengthen our outreach and support for our business community. We launched a $200 million partnership. We got a dozen or so of the biggest banks in town to commit to $200 million to make available to small and minority-owned businesses who were trying to do business with Cook County and may not have had the working capital that they needed to be vendors for the county. The Bureau of Economic Development, as I said, is led by Herman, and while it consists of a number of different departments, it's focused on how to maintain the vitality of the Chicagoland region. And again, it's not just us here in Chicago and Cook County, it's the three-state region. The Bureau has undertaken a number of initiatives which I want to share with you today. First, we have a new land bank authority to assist in identifying key parcels of land in areas where reinvestment is needed. But for various reasons, acquisition of land and redevelopment are difficult. I've seen firsthand how municipalities struggle to deal with vacant land and unproductive land. They lack the resources and the expertise that they need to pursue redevelopment. Activities such as land acquisition, erasing back taxes, and clearing title are costly and complicated. They challenge the abilities of even the most sophisticated municipalities, and financially strapped communities, and we have many of them in Cook County, find these obstacles insurmountable. I've asked the Land Bank Authority to help our local municipalities pursue their own redevelopment goals by designing services to meet their needs. So let me be clear about this. We're not at the Land Bank Authority setting local priorities. We're going to them to figure out what their priorities are and trying to help them implement them. I've also asked them to expand their scope beyond foreclosed and vacant homes. We need to think about not just building homes, but about creating jobs and shaping communities. Through the good work of Herman and his staff, we've received approval recently from the U.S. Department of Housing to create a $30 million below market rate loan fund that targets job creation, $30 million. The program, we hope, will allow us to borrow money from the private sector at reduced interest rates and promote economic development, stimulate growth, and improve public facilities. I expect this financing will help us to facilitate redevelopment projects that are identified and undertaken by the Land Bank Authority, so it'll complement the Land Bank Authority. Third, the Department of Planning and Development is about to undertake a 5-year strategic planning process to identify key housing, community, and economic development opportunities in targeted sub-regional areas. It's hard for us as a Bureau of Economic Development to work with all 130 municipalities. So what we've decided to do is try to work with kind of intermediaries. The best example probably is the South Suburban Mayors and Managers Association, which has a very well-developed plan for its own region, the South Suburbs, and what it's lacked over time is both the financial resources and the expertise to implement it. So we're working very closely with what we call our sub-regional intermediaries. We've also undertaken a strategic plan which looks at all of the real estate that the county owns. So you'll appreciate this story. I walked in the door and I said, okay, give me the book on what we own. So what was available to me was a computer printout of the parcels that were possessed by the county. But there was no distinction between improved and unimproved property, no indication what was the difference between the courthouses and the hospitals, nothing. So we just, we hired a firm, U.S. Equities, after a competitive process to give us a handle on what we owned, what condition it was in, a strategic plan for maintenance, for disposition if necessary, and for improvement. I don't know how my predecessors managed without it, but going forward, this is a document that we will have, which will guide our investments in our own facilities. We're reviewing our zoning code to put in place a more up-to-date code that will be easily adopted by municipalities. We're trying to get some universality here in an effort to make it easier for developers to work across municipal borders. The county continues to pursue competitive grant opportunities and partnerships with public and private agencies. For example, the Cook County, along with the City of Chicago Heights, the Housing Authority of Cook County, and the Chicago Metropolitan Agency for Planning, submitted a funding application to HUD for a planning grant via the Choice Neighborhoods Initiative. So if approved, this grant will enable the creation of a comprehensive redevelopment plan for Chicago Heights, an important South suburban community. Additionally, we're working to create more collaborations through expanding our home consortium, as well as identifying uses for private activity bonds. None of this will work without the right partners. We're working with several agencies around the city and the county to identify partners who have been concerned about making critical investments. We'll try to bring more and more innovative tools and approaches to the county, like those spotlighted in Investing What Works for America's Communities. Through the partnerships we're creating and greater focus on collaboration, the county can continue to prosper as the economic hub of the Midwest region. I thank you all for your attention. I'd be happy to entertain your questions. And there have to be some. What I usually say at this point is if there are no questions, I'll start calling on people. But Adam, you're next.
Is Adam going next?
No, go ahead.
Great. Thanks, Toni. Calvin Holmes with the Chicago Loan Fund again. Madam President, it's always great to be in your company. Thank you for your really appropriate remarks and very inspiring remarks. So I think I know the answer to this question, but I'd love to hear you talk about it. You mentioned that Chicago is one of the few alpha cities in the U.S. and that we don't just compete with our other large cities, we also compete with major metropoles around the world. The way that the Chicago Community Loan Fund thinks about low-wealth people and places is that they're very much a part of the solution. And I'd love to hear you talk about how you think lower-wealth communities in metropolitan Chicago can help the region be more competitive.
Lower-wealth communities. So that's the latest term of art?
Cool. There are all kinds of terms of art. I've been reading Investing What Works, and I've got a list of 20.
You know, when we have neighborhoods that are struggling, they're a drag on economic development for the region as a whole. And this is an equity issue. It's about investing in all of our communities and particularly all of our children. So let me talk about this in just a little bit different way. You know, we have terrible problems that we struggle with in this country around inequality. It's not just inequality of income, which is bad enough, but inequality of opportunity. You know, the example that I like to give is in the city of Chicago, we spend about a third as much on a per pupil basis as New Trier Township, which is one of the wealthy suburbs in the northern part of the county. And we also have a much higher percentage, of course, of poorer kids. So we spend less on them, and they start out in a more disadvantaged place. Now, I don't know how in the future of this country we're going to be able to be successful and compete internationally when we allow that terrible inequality. And I don't know how if we leave a good portion of our potential workforce behind in that way, that we can hope to be competitive. So I usually, when I talk, because I'm a teacher by profession, I spent 10 years in the classroom with good people like Bob. So when I talk about inequality, I usually talk about inequality for our children and lack of opportunity for our children. Because if we don't provide for them and if we don't give them a fair chance in the race, it doesn't matter what investments we make in the neighborhoods, in the physical neighborhoods. You know, you can improve housing, but if you don't improve the quality of the public schools, you're not going to really be able to attract families to the community. or businesses for that matter. So I am very troubled by what's happened, in particular in the last decade in this country. The way in which the economy has sort of bifurcated our population into those who are very affluent, a middle class that's getting more and more squeezed, and a large number of families that are struggling. I wish I had a magic wand to do something about this. It's not within my power. But I think it's something that we all need to keep in mind as we think about the communities that are struggling. And what I always want to do, I realize that a lot of us talk in community development about jobs and job creation. But if you don't graduate from high school, it's very hard to be a productive worker and to be attractive in the job market. And so let me give you some. This is probably not the direction you thought I was going to go, but anyway. So let me give you some disturbing statistics. In the Chicago public schools, the last figure I heard was we graduate about 2/3 of our kids over 5 years. Not 4 years, 5 years, 2/3 of our kids. But for African American young men, we only graduate 44%. Not much better for Latino boys. So we do better with girls than boys. Whites and Asians do better in the system than African Americans and Latinos. But if you're not graduating half of the young black and brown young men in your community, how on earth are they ever going to be able to support themselves and their family? And let's not talk about their much greater likelihood to be enmeshed in the criminal justice system, particularly African American boys. So I guess, when you talk about communities that are lower wealth communities, what comes to me is the larger question of inequality in our country, and in particular the uneven playing field for our children and the devastating effects that's going to have long term on our society. We can't leave. It's not in the interests of the wealthy, let alone all the rest of us, to leave so many of our young people behind. I'm sorry, I called on Adam. So Adam, you have a question? Are you gonna yield your time? Yes. Okay, yield your time. Yes.
I have a short question. You mentioned the fact that you grapple with 130 municipality structures, and Illinois leads the nation in the number of individual government units, which is job creation in itself. But is there any movement either within our Cook County, or do you see any movement among stakeholders throughout the state who are interested in grappling with this and reducing the number of government units?
The short answer is no. So let me just say, we have like 9,000 or something units of government in Illinois. The next state is Pennsylvania, and they have like 5,000. So we have twice as many as the next state on the list. A lot of these local units of government are not cities and towns and villages, but school districts that consist of one school or just a couple schools. And the people of Illinois have chosen this structure to have separately elected, school boards for their elementary school or their high school or their mosquito abatement district or whatever it is. You think that's funny. I appoint people to 50 boards and commissions. A lot of them are little mosquito abatement districts or sanitary districts. But these are units of government that the local communities have chosen. I will tell you that this is a terrible problem in Illinois, and I'm not going to address it. I'm not going to use my political capital to struggle with this because I got challenges here at home that I better focus on. But it's a real problem for the state. Here, there's a gentleman over here. Why don't you stand up and yell?
Okay. So I work at a graduate school here called Erickson Institute, specialized in child development and early childhood. You kind of opened the door there on that. But and suddenly I'm loud. So I work at Erickson Institute. My name is Gordon Wright. Obviously early childhood is what we're all about at Erickson, and we're I'm always inspired. I was very excited, to see Heckman's work in here and Sean Coffin. I mean, people are always careful to pay lip service to the importance of early childhood and these things. There always seems to be a lack of ownership and a lack of in the baton passing. I think you actually are one of the more influential people who can say that you don't have ownership over a lot of those things, so you're exonerated in some ways. But how do you think that the county can do things to accelerate that, especially after you made such a great point just now about those investments?
Well, I have opinions about a lot of things over which I have no control. So you have to understand that the main mission of the county is the public health system, which is 35% of our budget, and the public safety system, which is the courts and the jail, which is 42, something like that, % of our budget. So about 3/4 of our budget is public health and public safety, and the other 25% is everything else we do. Education is the responsibility of local units of government, including preschool education, early education. So while I think it's really important, the things that I spend my money on and what are part of our mission are basically public health and public safety. But, I'm in a position where I'm a countywide elected official. I have a bully pulpit, and I talk about the importance of education whenever I have the opportunity, particularly because I'm so troubled by the direction in which we seem to be heading. Yes?
Hi. My name is Drew Barrett, the Urban Innovation Center over at Illinois Institute of Technology. My question is, does the County of Cook have a international business development and foreign investment program and or agenda? If not, is one being entertained? Is one desirable? And can I help?
Well, Herman Brewer here will wave his hand, and you can see Herman later today. We have been focused, frankly, on regional issues and regional economic development more than international business. But I'm sure Herman would be happy to talk to you about the ways in which we might play a greater role in that area. But our focus has been on regional economic development. Our Council of Economic Advisors put together a plan this spring which outlines our concerns. And it's in terms of sectors, it's more about transportation, distribution, and logistics, food processing, and advanced manufacturing. So to the extent that those intersect with our international business agenda, that's the direction in which we're going in terms of supporting economic sectors.
Yes, my name is Emmanuel Pratt with two entities called Sweetwater Foundation and Chicago State University's Aquaponics Center. If the question I have is more, I don't know if it's philosophical, but it's pretty pragmatic. If we're talking about investing in what works in a policy forum discussion, with us being in the middle of a paradigm shift from one operation from a 20th century paradigm and what policies reiterated the 20th century with respect to work and employment and career pathways, and we're transitioning into a 21st century paradigm, which is a global initiative. How do we properly discuss what works, what didn't work, especially every 40 years we have this crisis, like the Kerner Commission report had this crisis they had trying to resolve. But there's a lot of stuff that we don't know what works, but we kind of know it intuitively that it works, but it hasn't been proven to work yet, and there's a lot of shift towards new forms of jobs and new career pathways and new forms of education, and there's a level of risk that is needed in that, in order to make that work. So how do we properly negotiate that in this paradigm shift?
Herman is laughing, which is a bad sign, because I'm not going to call on him to answer the question. I got to answer it myself. All right, here's the deal. So I'm an educator. I believe in education. I think that the most important thing that whenever I talk to kids, I say the best investment you can make is not in commodities. It's not in stocks and bonds. It's not in real estate. It's in education for yourself, for your children, for your family, for all of our kids. So when I look toward the future, what comes to my mind is that we've got to do better in educating our kids and helping them understand that education is a lifelong activity. It's not something that, ends with a degree, that in your lifetime you're going to have lots of different jobs and you're going to have to learn lots of different new skills, and some of that's going to require more education and training. If you're going to be successful in the workforce, that's what you have to expect. We've got to do a better job, of course, of giving our kids a foundation, and that goes to the high school graduation statistics that I just talked about. But, the most important thing you can learn you need to know is that you're going to have to pursue lifelong learning. That's the only way in which you're going to be successful as the marketplace changes and demands for skills changes. So I don't know if that's the answer you were looking for, but of what you said, that's what I took out of it.
How are you preparing, your health staff for the Affordability Act? I know that Stroger Hospital is already oversubscribed with patients, and I know Stroger and others have had a problem in not collecting insurance payments and that sort of thing. Are there a lot of changes that you're starting to implement?
Well, we've been blessed. We were able to steal from New York Dr. Ram Raju, who heads up our healthcare system. And Dr. Raju brings both vision and management skills, which the health system has been lacking for some time. Some of you in this room may know Ruth Rothstein, who was at our healthcare system for, 10 or 12 years. And since she left in 2004, we've had 6 or 7 different people in charge of our healthcare system. And even a well-functioning organization with that kind of churning at the top is going to have difficulty. So we're very grateful to Dr. Raju for his willingness to take on this challenge. He and I worked together last year to secure what's called a waiver, an 1115 waiver, which enables us to enroll people in Medicaid right now who will not be eligible until January of 2014 under the Affordable Care Act, ACA. ACA changed the Medicaid rules. In Illinois, for a very long time, only those who had disabilities were eligible for Medicaid, which is federally supported health care for people under 64. Because if you're 65 and older, you get Medicare. So ironically, in this country, we were prepared to provide federal support for the elderly and not for the next generations. Rod Blagojevich, and I usually say, give the devil his due, said it's not right that we're not taking care of our children. And he expanded Medicaid, that is the program that supports health care for segments of the population under 64, to include uninsured children. And that was a great boon, because there are lots of people who have jobs that provide insurance for only them. Not to mention the people who have no insurance at all. But only the worker is provided with insurance. And if you want insurance for your family, you have to pay exorbitant premiums, which most people can't afford. So Medicaid was expanded. And when you read in the Tribune all these criticisms of Medicaid costs, just remember that they've risen because we're insuring our children who were uninsured before. Okay? They never say, rising Medicaid costs are just a disaster. But they don't say the reason that the costs have risen is we're trying to take care of our children, which I think would give people a little different spin on the problems. So the Affordable Care Act said, whatever rules you had in the state about Medicaid, and they varied from every state was different. From now on, people whose individual incomes are less than $15,000 and whose two working members of the family income is less than $20,000 can get Medicaid. So it's going to be income-based. In addition to whatever other particulars there are of the state program, it's going to be income-based. So this population, singles, 15,000 or less, and couples of 20,000 or less, will be able to get Medicaid coverage. Now, if you work in a restaurant, if you work at Walmart's or Target's or whatever, the likelihood is that you will fall under that 15,000 or less for individuals or 20,000 or less for couples, because either you don't have full-time work or you have very modest wages. So there are large portions of the working population in this country that will now be eligible for federally supported health care coverage. And this is a very good thing. Now, what we're doing at Cook County Hospital and in our healthcare system is trying to provide what Dr. Raju would call a medical home for people to ensure that they get primary care. Because previously, those who were uninsured or underinsured came into our system through the emergency room. So whatever condition they had was so bad they ended up in our emergency room. Or they didn't have a primary care physician, so if they really had a bad headache, they came to our emergency room. And as Dr. Raju likes to say, if you go into the emergency room with a bad headache, they give you a CAT scan to make sure you don't have a brain aneurysm. Whereas if you went to your primary care physician, they would say, okay, so what are you taking for it? You know, acetaminophen, ibuprofen, what are you taking? Have you been getting enough water? Because if you don't drink enough water, you'll be dehydrated, you'll get headaches. And they will go progressively up the scale to try to figure out what's the matter with you instead of starting with a CAT scan and going down. And CAT scans, you know, I don't need to tell you, are extraordinarily expensive. So if we can not only bring people into our healthcare system, which is called county care, but help them get regular care from a primary care physician, they will be better off and it will cost us less to serve them. And furthermore, we'll get reimbursement from the federal government for their care. And every year, the good people of Cook County spend $500 million, $500 million on caring for the uninsured and underinsured in our healthcare system. And the demand, of course, for our services has gone up as the economy collapsed because people lost their jobs and lost their health insurance. And for the first time in their lives, many of them were dependent on the public health system to get good service. So what we're doing is in our health and hospital system is enrolling people in county care, trying to provide them with a medical home that is a primary care physician so that we can help manage the often complex and health circumstances that they find themselves in. For example, we have lots of people who have both, you know, diabetes and hypertension. Those are illnesses that are disproportionate in the African American and Latino communities. So we have lots of people who have both of those. And we have lots of people whose interaction with health care has only been through the emergency room. We've got to get them accustomed to going regularly to a primary care physician so that they can manage their illnesses. And so that whatever health difficulties they have are caught early rather than coming into our emergency room or a hospital with stage 4 cancer, which happens more frequently than we would care to admit. So I guess what I'd say is under new leadership, we have a vision which is focused on primary care and management skills to deal with some of the other issues that you mentioned, like not having a system in place really to bill people or collect from people who actually had insurance and so on. We've got a lot of challenges ahead of us, but the Affordable Care Act provides us an opportunity to be reimbursed by the federal government for care that we've previously been delivering for free. And also it provides an opportunity for individuals to get the primary care that they desperately need and have not had, many for much of their lives. So it's a good thing. Adam.
Couldn't pass up the opportunity. Adam Gross from BPI Business and Professional People for the Public Interest. We're a nonprofit public interest law and policy center. At the beginning of your remarks, you talked about investments that the county is now making in the future, and you talked about essential services that the county provides. Can you talk a bit about how the current pension system affects the county's ability to make those investments and provide those services, and tell us what we should be doing to move forward?
So if you look at the state and the city of Chicago and Cook County, our pension systems are in the best shape of any of those. But my chief financial officer likes to say that it's the equivalent of having the best house in a bad neighborhood. So our pension funding levels are in the 50%. Not good. You want to be closer to 80. We were working with our unions for a year and a half. We put money on the table ourselves. We were prepared to increase the county's contribution. We were prepared to assume the equivalent of the health care expenditures that were given to retirees, assume that on the county side rather than making it come out of the pension fund. So we put a lot of things on the table. We asked for raising the retirement age, changing the COLAs, a number of concessions from the unions. We were making progress. And then basically we got preempted by Springfield. And our union leaders focused on working with President Cullerton in the Illinois Senate around a bill which was passed in the Senate, never called in the House. And of course, Speaker Madigan drafted a separate bill which I understand is projected to save considerably more money for the state, and passed that in the House but would not take up President Cullerton's bill. So we have two competing bills now, one passed in the Senate, one passed in the House, very different, and no compromise on the horizon, despite the fact that there's a meeting of the legislature on Wednesday. So how does that impact us? Well, as soon as the legislature finished its regular session and there was no pension deal, the bond rating authorities, as you saw, downgraded the state's pension funds. Our chief financial officer had a conversation with all of them to try to keep them from downgrading ours. It had the ripple effect. Every unit of government in the state of Illinois suffers from being in Illinois because the state legislature can't work this out, and our financial situation is so dismal. I think we're in the worst financial shape of any of the 50 states. For a while we were vying with California for that dubious honor, but I think we're pretty much all alone now. So, so the pension problem is one for virtually all of us to struggle with. As I said, we approached it differently. We tried to work with the unions rather than just sort of announcing something and try to move forward with it. But we got preempted by the state focus of our union leaders, and it's unclear what's going to happen over the summer if there isn't an agreement between the House and the Senate on what to do. My sense is that the governor would sign whatever they agreed to. It's just that there doesn't seem to be any agreement between the two of them. And, you know, I should say, there are people who in the past have had a pretty good working relationship. President Cullerton is godfather to Andrew Madigan, who's the youngest of the Speaker's children. But there seems to be a lot of bitterness and animosity at the moment between them.
Earlier in your, Tim Herwig, OCC, though my question comes as a private citizen and not a representative of the U.S. Treasury Department.
Having made that quite clear, what's your question?
Yes, right. Has nothing to do with banking. Earlier in your remarks, you talked about a job growth loan fund, and there's been a lot in the press over the last handful of years about the reshoring of manufacturing, and I was wondering if you're seeing any of that to a notable or significant degree in Cook County, and if not, do you have any comments on the subject?
Herman says yes. I mean, I can tell you a couple of anecdotes. A manufacturer talked to me about producing a product in China and then discovering it in the marketplace significantly discounted, produced, he could tell, by the same factory that was producing his branded product, and deciding as a result that he didn't want to manufacture in China anymore and that he would bring the manufacturing here. Now, the manufacturing that returned is advanced manufacturing. It's robotic, so the number of employees is not nearly as great as it was when they were producing the product in a more traditional way here at home before they went off to China. But he's brought the manufacturing back here because he doesn't want to give away his technology to the Chinese anymore. Yes?
President Preckwinkle, we're very fortunate to have you here in Chicago, thank you, and in Cook County and in Illinois. And just in terms of your leadership, you know, you're very pragmatic and transparent, and I think just, you know, really speak to the fundamentals. And one of the things that you've spoken about in the past is when we talk about what works in communities, and I think some people here have alluded to, a broader swath of constituents that we bring under that tent. And one of the populations that you sometimes talk about is people in our criminal justice system as well as our juvenile justice system, and the importance of reforming that area. And I'd just like you to speak to that a little bit.
Thank you. So about 42% of our budget is criminal justice system. What I usually say is that we have, for the last 30 years or so, pursued stupid, expensive criminal justice policies, particularly around drug use. I've been speaking a long time about the failures of the war on drugs. When I was alderman, nobody paid much attention. But now that I'm county board president and I say these things, it gets a little more resonance. We have, over the last 30 or 40 years, criminalized a lot of petty antisocial behavior and increased the sentences for crimes to the point that we have had, at both the local and the national level, dramatic increases in the number of people in our jails and prisons. And those people are disproportionately black and brown, especially African American. So you may have read in the newspaper the ACLU report about drug convictions and how, for low-level drug offenses in the state of Illinois, assuming the same background, roughly the same criminal histories or lack of them, an African-American defendant in the state of Illinois was 5 times more likely to be sent to prison for a comparable drug offense than a white person. And in the county of Cook, it's 8 times more likely. Now, let me just say, illicit drug use is about the same across racial groups. Whites, Asians, African Americans, Latinos, about 8 to 10% of the population uses illicit drugs. But what happens in our criminal justice system is that disproportionately African American and Latino young men are picked up for drug offenses and are enmeshed in our criminal justice system, which makes it very hard for them, once they have a felony conviction, to support themselves or their family, because they always have to check the box. You ever been arrested and convicted of a crime? So I'll recommend to you what I always recommend, and that's Michelle Alexander's book, The New Jim Crow, Mass Incarceration in an Age of Colorblindness. So I was an alderman, and I knew about this issue sort of tangentially as an alderman. I'm appalled as county board president by the way in which we've allowed our criminal justice system to criminalize so many of our young people, to deprive them of the opportunity to be productive citizens. And at just tremendous cost to taxpayers as a whole. So it costs $143 a day to keep somebody in our jail. It's $52,000 a year, more or less. That's tuition to Harvard. We're going to be sending all these kids to college for what it costs us to keep them in the jail. And just be sure you understand, only 10% of the people in the jail are serving a sentence for a crime. 90% are pretrial detainees. They're basically people who can't pay their bond. So not only is the jail at the intersection of racism and poverty in this country, it's a poorhouse. So you and I are accused of a crime, God forbid. So we, take out our credit card and pay our bond, and we're back. You could be accused of murder and have $1 million bond. If your family can come up with $100,000, you're out on the street. So the people who are in our jail are not necessarily the most serious offenders. They're the people who can't pay their bond. And 70% of the people in the jail awaiting trial, remember, only 10% are serving a sentence, 90% are awaiting trial. 70% of those people who are awaiting trial for nonviolent offenses. So they're drug offenses and prostitution and shoplifting, the things people do to get money for their drugs. They're driving offenses. I talked to a young man a couple weeks ago who was in our criminal justice system because he was driving on a revoked license. Now, because he couldn't pay his bond, he lost his job. So he couldn't support himself and his family. Whether he's found guilty or not, and he hasn't been tried yet, he's already in a worse place than he was before he went into the jail. We need to focus our resources on the 30% of the people who are awaiting trial for violent offenses and try to look at alternatives to detention for those who are nonviolent offenders. And everything that you do, you put somebody in a drug treatment program, it's less than it costs to keep them in jail. You put them in what they call day reporting, so they go in the morning for behavioral health services, mainly help them figure out how they got to be substance abusers and what help they can get for their addiction. And then employment training and education in the afternoon. That's the day reporting center. Everything you do that includes services costs less than what it costs to keep people in the jail, and only 10 to 15% of the men and 40% of the women in jail get any services when they're there. And the overwhelming majority, of course, are men. So thank you, Sandy, very few of the young people in jail who are awaiting trial. Overwhelmingly, they're awaiting trial. They haven't been convicted of anything. In our criminal justice system, you're innocent until proven guilty. The overwhelming majority that get them no services in the jail. So this is we've chosen to deal with, as I said, petty antisocial behavior and addiction in very expensive and destructive ways. It doesn't serve us as a society to criminalize so many of our young people and to diminish their life chances in this way. But unfortunately, the political reality is you get a lot more credit for being tough on crime than trying to be smart about crime. At every level. It's not just the city and the county, it's at the federal level too. They're busy increasing the penalties for everything they can think of and filling up our jails. So one last thing before I go. My husband insists I say this wherever I go. We have 5% of the world's population, 15 million people. We have 25% of the people in the world in jail or prison. You would think it was some awful, misbegotten dictatorship, in Eastern Europe or Asia or Africa someplace. But it's us, ladies and gentlemen. Thank you.